had explained it should be starting at around 9:30, and he will be crossing over there shortly. When it begins, Ibrahim Karanja will be giving us more details on that. Now from Nakuru, let's talk about issues to deal with health. The Ministry of Health is now administering the COVID-19 vaccine in three-prong approach: first jabs, second dose and booster shots. Our health reporter Saada Hassan has the details. Saada, good morning. Talk to us about this booster program.
Good morning, Ashley. So indeed, yes, the ministry is administering booster shots right now, and this is mainly just to ensure that more Kenyans are protected against the COVID-19 vaccine. So booster shots do not necessarily mean that you're not safe per se, but it's just, adding an immunity to your body, because after you get the first shot and you get the second shot, after a period of time, the immunity wins out. So in order for you to be protected, you need to get another booster shot for you to, survive throughout this COVID-19 pandemic season. So the booster shots are now being administered countrywide, not for everyone basically, but it's just for people who are above 15 years of age, that is for teenagers and also adults. So it is a process that has begun. We do not have the minute details of how many people have received the shots yet, but it is a process that has already begun in the country. So far we have been able to vaccinate 10.6 million people in the country. 6.6 million have received the first dose, and 4.5 million Kenyans have received the 2 doses. So this means that we are still not at the right track, because by this time of the year, because bearing the fact that on 31st December 2021, we administered about 200,000 shots of vaccines. So going by this trend, by right now, we should be way above the 10.6 million, but it is a process that is ongoing. Right now, we're seeing a lot of heightened political activities in the country. And, this is creating a lot of worry, because we've seen rallies across the country in different parts, maybe Kisii, Kericho. And at the end of the day, when we look at how viruses spread or how diseases spread, then these are some of the key areas that are likely to spike up spread of infections, spread of diseases. And at the end of the week, this is something that we should be looking at. If these are areas that are spreading, are factors that are contributing to the rise of COVID-19 cases in the country. So yesterday we had about 700,000 cases of COVID-19 recorded, and this was a positivity rate of 20.8%. It is an increase from 19% the previous day, but overall the scale has gone down compared to around the first week of January, whereby we were recording about 30%. So it is a drastic slow of the positivity rate, but we cannot say that we are at the right track yet, because when we talk about positivity rate and when we talk about new infections, then we go back to our capacity as a country. Are we able to vaccine? Are we able to test as many people as possible? Do we have the necessary surveillance tools available in each and every place countrywide? So when we're able to test a huge number of people, then it translates to the number of infections that we are receiving. But if we're only doing targeted testing, and targeted testing, it means we're only looking at people who are coming into and going out of the country. Those are the people who are testing. And also we're looking at people who are presenting symptoms and signs of COVID-19. Then it means at the end of the day, we're not able to capture the whole picture of how many people have this virus in the country. But we've seen the number of people who are under home-based care are quite a lot, about more than 20,000. So this means the virus is really spreading within our communities. Also right now, it is important to mention that the variants are still spreading fast and across the world. We have new variants coming in, and the World Health Organization insists that these variants will still keep on coming. So no matter how much we say we're done with Delta, we're done with Omicron, another variant will still come up. So it's up to us to ensure that we have the proper surveillance mechanisms we need as a country in order to detect some of these variants that will still keep on coming out every now and then.
Right. Saada, I want us to still talk about the booster shot. Of course, COVID-19 is endemic, and this means that this is something that we're likely to see go on for years to come. But then for the sake of our viewer, when you talk about mixing vaccines, I remember some time back there was that issue. Does this apply for the booster shot too? For example, if I have as the AstraZeneca vaccine, that's the shot that I got, what booster shot will I get? Will I be able to mix, or is it still the same?
All right, so at the start of the pandemic here in Kenya, the Ministry of Health insisted that we are not going to mix vaccines. But, over time, a lot of these regulations have been changing when research is done and, the country comes up with new mechanisms or new regulations. So about 2 months ago, the Ministry of Health released new guidelines on mixing of vaccines, whereby if you got AstraZeneca, then you will still get AstraZeneca, because AstraZeneca has a different mechanism compared to the mRNA vaccines, which is Moderna and Pfizer, because these vaccines require a certain way of preservation. They require up to a certain degree of temperature in order for them to be stored and to remain active. So if you got Moderna vaccine, then definitely you will still get Moderna, or you will get a Pfizer vaccine as a booster shot or as the second dose vaccine. But if you got AstraZeneca, then you will still get AstraZeneca, because how the spike protein works is different from how it works in Moderna and Pfizer vaccine. When we are injected the Moderna and Pfizer, the general spike protein, which is outside, is the one that helps us to, it introduces the protein into our bodies so that we can be able to fight off diseases. But then this works differently for AstraZeneca, and it is a whole different level of technology with the mRNA vaccines. So that is why you cannot be able to mix some of these vaccines, Ashley.
Sada, as we wind up, after how long am I supposed to get the booster shot once I've been fully vaccinated?
So once you get the first and second dose of vaccine, then after 6 months has lapsed, you can be able to get the booster vaccine. But it is important to remember that these vaccines, it's only Pfizer that can be administered to teenagers, that is from 15 years of age and above. But the rest is only for adult population.
All right, thank you very much, Saada Hassan, for that. Of course, that's what the health desk is following up on, this and many stories on the Health Diary. But as we move on, Westlands member